I've been having pain, swelling, and redness in my lower leg. I'm quite worried as redness seems to spread quickly and it's hurt a lot. Based on what you have described, it could be cellulitis, which is a bacterial infection of the skin and the tissue in the deeper layers just under the skin. It causes inflammation, swelling, redness, heat, and pain. How did I get this? I really didn't have any serious injury. It's common for cellulitis to start where there's a break in the skin, even small ones like cracks, rays, insect bite, or even very dry skin or eczema. These breaks allow bacteria that normally live on the surface of the skin to get inside and multiply. Also, certain conditions like diabetes, weakened immune system, circulation problems, skin conditions like tinea, eczema, and previous episodes of cellulitis make cellulitis more likely. What should I look out for? What I have feels hot and painful already. Cellulitis generally only affects one side of the body. The area of the skin affected by cellulitis becomes red, painful, or tender to touch, hot and swollen. It most often affects the lower legs but can occur in any part of your body, including your face. Blisters may form and the affected area may grow larger. This can happen quite quickly, over hours to few days. You may also feel unwell and feverish, with a high fever and shivers. This may start a few hours or a day before the skin changes become visible. How do you treat it? Treatments include antibiotic, supportive care, monitoring, and treat any underlying conditions. For mild to moderate cellulitis, oral antibiotics are usually used. In New Zealand, flucloxacillin is often first line, sometimes alongside with probenecid, which helps increase effectiveness by keeping the antibiotic in your system longer. If the infection is severe, intravenous antibiotics may be required. Cellulitis can be quite painful because it puts pressures on the skin from underneath, so pain relief may be required. Marking the edge of the redness help track whether it's spreading. If there's at least foot, eczema, cracked skin, will help address those and control of diabetes or other immune weakening conditions. What can I do while I have it to help it get better? Rest the affected area, reduce movement, especially early on, elevate the limb to reduce swelling, and stay hydrated to support recovery. Take full course of antibiotics as prescribed even if you start feeling better. Do not stop early unless directed. I don't want this happening again. How do I stop it from coming back? Yes, recurrence is common, but there are many ways to reduce the risk. Keeping your skin clean and well moisturized. Dry skin causes cracks, which increase your risk of cellulitis. Cleaning any cuts or wounds and treating any breaks in your skin. Preventing cut scrapes by wearing protective clothing, gloves, and footwear. Keeping your fingernails short and avoid scratching. If you have diabetes or poor circulations, you are at risk of cellulitis. It's important that you check your feet daily, moisturize your skin, trim your nails carefully, and treat any infections on the skin quickly. If you have had cellulitis more than once within 6 months, you may be prescribed low-dose antibiotic long-term to stop the infections coming back. That was so helpful. Follow Celine the nurse to learn more about your health.